Welcome back into Fox 10 Midday. Today we are discussing a very important topic that affects many of our viewers, and that's men's health. Joining me here today to talk more about this is Kelley Gunn, a physician's assistant from Urology Associates of Mobile. Kelley, thank you so much for being here.
Thank you for having me.
So obviously a very important topic. Let's just jump right in with a very simple question. What is men's health and why is it so important?
So men's health is the idea of addressing things that change with men as they age, and most specifically this is typically in the sexual realm. We also know things will happen both cardiovascularly and metabolically as men age, but a lot of times this is dealing with things that have to do with the bedroom.
Gotcha. And what are some of those main health issues that you guys take a look at in your office?
Yeah. So a lot of the big things that guys will deal with as they age is erectile dysfunction. It is an age-associated thing. We do know men's erections worsen as they age, and low testosterone. The incidence of low testosterone is increasing for a variety of different reasons, but also includes things like infertility. There's a big rise of infertility in younger men as well, and so we do treat for that. That also would include things with urinating. So most guys are going to have some issues peeing as they age, so we address those things, as well as ejaculatory disorders, which are very distressing for some men.
Gotcha. I think across the board, several people delay getting treatment for various issues, maybe especially men in this demographic. What would you tell them if they're watching this interview right now and they think, I'm suffering from one of these problems?
Yeah. So on average, specifically for erectile dysfunction, most men delay fulminant treatment for 4 to 7 years. There's a lot of shame with it. There's a lot of embarrassment. And it does impact a lot of quality of life things with men. What I tell you is there's ways to get you there. It's just a matter of what it takes. Yeah. We've got different treatment options for all men. We've got other things that we'll check to see if anything's affecting you. So there's a lot of ways to get you where you want to be.
Can you give us just a few, maybe just a generic success story? Maybe someone came in and said this was, difficult to seek treatment in this area, but walked away really happy that they did.
Yeah. So I've got a few men in mind. One of them in mind was a gentleman who he had prostate cancer, and there's some things that happen with prostate cancer specifically in the bedroom, and we couldn't get him exactly where he needed to go on medication, and he had some surgery for his erections and did really well with it. It's something that he delayed for a while, and he was really happy with it afterwards. He also had some other issues with his testosterone that we found we were able to correct, and overall sexually him and his partner are doing a lot better.
Good. So the big story here is that you guys are here to help because you care about your patients, and that's so obvious for sure where you guys are at. What are some pillars of conservative management for men's health issues?
Yes. So big things is metabolically, watching what you eat, checking for diabetes. There's a lot of metabolic issues will cause sexual dysfunction, so talking with a primary care physician to address those do happen. Low testosterone would fall on that too. Resistance training. The data has become very clear that resistance training helps with your testosterone and your lean body mass, which can also help with the erections. Anything you do for your heart is good for your testicles, what I tell all of our guys too.
Very good to know. What other screenings are done with men's health as well? Sure.
So a big thing that we really harp on is prostate cancer screening. Okay, 1 of 8 men will get prostate cancer. It's one of the most common diagnosed malignancies in the U.S. But if it's caught early, it's a very treatable disease. I tell most guys you should die with prostate cancer, not of it. So in age-appropriate men, we will screen them too at the same time as we're working on everything else with them.
Yeah, Kelley, before we wrap up today, if folks need help and want to get in touch with you guys, how can they do that? Yeah,
so just give us a shout at Urology Associates. We've got multiple locations in Mobile and Baldwin County. We even get into Mississippi too. If you give us a call at 251-433-1895, we'll get you set up as a new patient. Typically you'll see one of our board certified urologists first, and then subsequently I'll see a lot of the men after that.
Wonderful. It's always great to have you on the show. Thank you for your insight today. And again, we'll have a link to this full interview on our website, fox10tv.com, as well as a link to Urology Associates of Mobile. Thanks again for being here.